All right, everybody. Welcome to my live YouTube uh, video. We are going to be teaching you guys pharmacology today. I'm actually super excited about this. You guys are going to be learning so much when it comes to pharmacology. If this is your first time, all right. Hello, everybody. Welcome to my live pharmacology review. If you're just joining me live here on YouTube, I am super pumped. It's been a while that I have actually gone live on YouTube. I wanted to go over pharmacology with you guys today, show you exactly how you can study for pharmacology the easiest way possible so that you can be able to pass your USMLE on your very next attempt. All right. So if you're just joining me, you can just put your messages in the chat. If you have any questions while we go over these review sessions. All right. And just kind of tell me where you guys are from. We're going to be going over USMLE Step 1 Pharmacology review today. I am actually super pumped. I haven't gone live in a while, so this is going to be exciting. Now, if you're studying for USMLE, if you don't know me, my name is Dr. Adesina. I'm the CEO and founder of Smash USM Reviews. I've been teaching USMLE prep for the last 10 years, okay? So definitely, you can call me the world expert when it comes to USMLE prep. First of all, I want to say thank you everybody for following me on YouTube. Thank you for following my channel. Thanks for watching all my videos. Today I'm going to be breaking down pharmacology today, and share this link with your friends before we begin, so we can start talking about some pharmacology. And I will be teaching you guys exactly the tricks I used to pass my USMLE match into emergency medicine residency, and definitely show you guys how to be able to use your question bank to be able to pass your USMLE. Okay. Now, before we begin, pharmacology is one of the most challenging topics for a lot of students because they feel like pharma is very difficult. It's not. It's really not difficult. All right. I'm trying to make sure we get everybody on our live session right now. Okay. And for a lot of people, they don't realize that pharm is actually easy. I'm telling you. Like, you might feel like, oh my God, I'm overwhelmed. Every time I study pharmacology, I forget. But you know what? As a physician myself, I've been practicing for over 10 years. Let me see here we got in the chat. Hey, Kefiwe, what's going on? We see here, my voice is echoing. All right, let's try to fix that. I think I know why the voice is probably echoing. All right.
How's that now? Is it better? Can everybody? Is it much better now? Let me make sure. Can you hear me better? All right. Let me know if you can still hear any echoes in my voice. Let me do this so we can fix this before I start teaching. A lot of feedback. Okay, Kefilwe, what do you think? Are you still hearing a lot of echo? All right, awesome. Elizabeth, how you doing? Where you guys from? You guys have been following me on YouTube for a while now, and I'm super pumped. Thanks so much for joining me right now today. So today, how many of you are studying for USMLE Step 1 or Step 2 CK? And maybe you have some challenges with USMLE prep, or maybe you're in medical school, right? So for those of you who don't know me, so I'm an ER physician. I'm board certified in emergency medicine. I've been practicing for 10 years. I'm the CEO and founder of Smash USMLE Reviews. I've been teaching USMLE prep for over a decade. Some of you have probably seen a lot of videos on YouTube. So today, I wanted to go over pharmacology with you guys today. Let me adjust my camera a little bit there. Okay. I wanted to go over pharmacology with you guys today so you guys can actually master pharmacology. All right. So if you have any questions, just post it in my chat. I'll be able to respond to your chat questions over there. All right. And so we can begin our lecture today. All right. So for those of you who don't know, this is our Smash USMLE question bank actually. So what I'm teaching is actually directly from my course from Smash USMLE Reviews. So you guys can actually be able to get that advantage. All right. At the end of this presentation, I'm going to give you a special offer for those of you who are watching today. So definitely, make sure you stay to the end. All right. Because I'm going to be giving you guys some special bonuses. All right. Cool beans. All right. Awesome. So this is pharmacology, right? What we're going to do today is we're going to break down some pharmacology questions, all right? I'm actually going to spend some time, all right, showing you how I answer pharmacology questions. So let's start with the first case of the day, all right? Look here, right? We have a question. Now, a lot of you guys, when you're studying for the USMLE, maybe you're studying for step 1, step 2, CK, step 3, right? The most common mistake I see a lot of IMGs or medical students make is that they start looking at questions in the question bank, and they say, oh, Dr. Adesina, I'm just going to jump right into the question. Right now, first of all, never do that. Never ever do that. All right. I'm going to teach you the trick that I use to actually always do my questions. I use something called the ease method. All right. So the first thing is I'm going to look at the options. All right. Right here's the options. And I see here methemoglobin levels, plasma nitroprusside concentration, serum thiocyanate, urinary cyanide concentration. And here I see urinary nitroprusside concentration. Now, just by doing that, that tells me this is a pharmacology question. Right? Because on the actual USMLE exam itself, right? The problem with a lot of students is that they get overwhelmed, right? They're gonna give you random questions. They're gonna be like, oh my God, you're gonna see psych, and then it's gonna be endocrine, and it's gonna be, pathology, and then it's gonna be GI, right? So if you don't look at the options first, then you're just gonna jump right into the try to read the questions without actually knowing exactly what they're gonna test you on. Okay, cool. All right, so here's what I want you to do. All right, here's what I want you to do. Look at the options and let's break down these concepts. All right, so we got a 78-year-old male experiences hypertensive emergency, right? And then is given sodium nitroprusside intravenously. The patient's nitric oxide levels can be monitored by which of the following laboratory tests, right? Now, if you don't know the answer to this, right? First of all, you have to know what sodium nitroprusside does. Second of all, you have to know the mechanism of action of sodium nitroprusside. Third of all, you have to know what the indications for this drug is, right? And also the side effect of the drug. Okay, let me break that down for you guys again, all right? Pharmacology requires you to master 5 things, right? The name, the drug class, because once you know the drug class, you kind of know what we're going to be using it to treat. Indication of the drug, because what are we going to be using the drug to treat? And third of all, right, what is the contraindications of the drug, right? The side effects, right? So those are the things you have to know, right? But look, in this case, they already told you, 78-year-old male experiences hypertensive emergency, right? We're giving sodium nitroprusside. Now, what do we need to monitor? Well, the first question is it methemoglobin levels? No, I'm not worried about methemoglobin levels, right? Now, this requires you to have advanced knowledge because methemoglobinemia, right, can be caused by, benzocaine, for example, right? But sodium nitroprusside does not cause methemoglobinemia, right? So you need to know that. That's very important. Okay, there are other drugs that cause methemoglobinemia. You should know for the USMLE, right? Plasma nitroprusside concentration, right? So sodium nitroprusside is not a drug that we need to measure the level inside the bloodstream. That's another important concept for the board exam, because for most of you guys, you have to understand, like lithium, for example, right, has a narrow therapeutic index. You have to be very careful. Digoxin is another drug that has a narrow therapeutic index, right? Also, valproic acid is another drug. Phenytoin, which is a drug for seizures, is another drug that you have to monitor the therapeutic index of the drug. So you need to know the drugs in the USMLE that they always test you that have a very narrow therapeutic index, or just we have to monitor the drug levels because of toxicity of the drug. So when you put a patient on the drug, right, you got to make sure that the patient is not having toxicity from that drug. Okay, got it, guys? Okay. Now, so the option C, they're saying serum thiocyanate. Could it be? Oh, we'll see. How about urinary cyanide concentration? We don't measure urinary cyanide concentration, and the urinary nitroprusside concentration. We don't measure the drug concentration inside the urine for this drug. The correct answer for this is serum thiocyanate. All right. Now, this is not the last step. This is just the beginning. You need to know why that is correct. All right. You need to know exactly why this is actually correct. Because if you don't know that, then you haven't learned anything. One of the biggest mistakes I see a lot of people, right, when they're studying for the USMLE is that they They think just answering the questions is enough, but that is not enough for you to be able to master the concepts. You guys understand what I'm saying? That's just not enough. Mastering the information and know what is the most important. There's one important point that they want to test you on sodium nitroprusside inside these questions that you must know, which is the mechanism of action of sodium nitroprusside. Now let's break this down, okay? Now, sodium nitroprusside actually is metabolized, right, to produce nitric oxide. You guys know that nitric oxide is a potent arterial vasodilator. When you give a patient nitroglycerin, right, who's having angina, right, it vasodilates the endothelium. You understand what I'm saying? It vasodilates the endothelium, which allows you to increase blood flow, right? Now, how does it do that? That's the key thing, right? It does that by stimulating the cyclase in the vascular smooth muscle, thus increasing cyclic GMP, activating protein kinase G and causing relaxation. That's how it works. So sodium nitroprusside is going to bind to the surface of the blood vessel. It's going to activate, right, cyclic GMP, right? And cyclic GMP, right, is going to increase of cyclic GMP is going to cause relaxation. It's going to activate a bunch of protein kinases downstream and eventually causes relaxation. That's the most important concept you guys need to know. Now, why do we need to use this drug? Well, we use it for hypertensive emergencies. What is an hypertensive emergency? Well, if a patient has a blood pressure of 220 over 120, a blood pressure of 210 over 100, and is having a headache, maybe they're having chest pain, right? They're having a hypertensive emergency. I see this all the time in the emergency department when I'm working. And the biggest challenge is you need to know how to manage this. Now, on the board exam, they're going to probably give you the vital signs. They're not going to tell you hypertensive emergency. They're going to just give you the blood pressure of 250 over 110. At that point in time, you're like, oh my God, this blood pressure is too much. All right. Now, here's the problem with sodium nitroprusside. Remember, it produces nitric oxide, which is what's causing relaxation. Because what happens in hypertension, guys? What happens in hypertension? Your blood pressure is high because increase of systemic vascular resistance. If your vascular resistance is so high, right, everything is clamped down. You want to relax, calm down, guys. You guys ever feel tight while you're studying for the USMLE? Yeah, that's how your blood vessels feel tight. You see what I'm saying? So here's what happens. It also releases cyanide, just small amount of cyanide, right? Now, remember, in the electron transport chain, there's complex 1, 2, 3, 4. Well, the electron transport chain happens in the mitochondria, guys. In the mitochondria, that is the powerhouse of the cell where ATP is being generated, right? That's why we generate all the ATP we use for glycolysis, right? We use ATP for pretty much almost, it's the most important energy molecule in the body. Catalyzes enzymes, right? Kinases, right? Phosphorylases. All of them use ATP. So guess what? The problem with sodium nitroprusside is that it releases small amount of cyanide. Well, cyanide is not good because cyanide is a lethal inhibitor of cytochrome A3 and complex 4. Oh my God, guys. If you're inhibiting complex 4, which is the last complex before you make ATP, what happens? You shut down the energy cell of the tissue. So that's bad, right? So the problem is cyanide is metabolized into thiocyanate inside your plasma, right? That is why we check serum thiocyanate levels. Okay? That's why we check serum thiocyanate level, all right? Now, what happens with this drug that we're really concerned about on the boards? We're worried about cyanide toxicity. Actually, I don't use this drug in the emergency department, period. You know, I give IV esmolol. I'll probably give IV labetalol. I give nicardipine as an IV drug. Actually, in real practice, we don't even use sodium nitroprusside because of all this. It's an old drug. We don't use it anymore just because of the problems. I don't want to deal with cyanide toxicity, right? You understand what I'm saying, guys? If you understand what I just taught you, say yes in the chat, okay? Because on the board exam, this is how you are going to be able to pass step 1. Step 2, CK, this is how you get a 250, 260, 270. This is the knowledge level you have to have. You guys understand what I'm saying? So guess what? Now, I'm going to show you how to use, how many of you is probably using first aid to study, right? You know, and you feel like, oh my God, you know, first aid is so hard to follow, right? Say yes in the chat if you feel like first aid is so difficult to follow, right? Okay, now let me show you my own step one book. And so some of you might not, I've seen my step one book before. All right. I'm gonna go live real quick on Instagram, kind of tell our users to follow me on Instagram also, okay? All right. So this is my step one book. All right. And I'm gonna show you the ebook version of this book, all right, which is available, which contains pretty much all the concepts you're gonna need to know for step one. All right. So let me share my screen real quick. All right, here we go. All right, everybody can see that? Perfect. Okay, so here, I'm gonna search for nitroprusside. All right. Let me just search sodium nitroprusside. Give me a second. Sodium nitroprusside. All right, there it is. All right, just taking a few seconds to search right here. Can everyone just see my screen? Does anyone have any questions so far? Anybody has any questions so far? Did you understand the concept I just taught you? How sodium nitroprusside causes cyanide toxicity. All right, okay. Now, this is my own step one book. It's about 800 pages long. All right. I'm going to go right here. You can see if I go in here, right, in my own textbook, right, compared to first aid, which is difficult to read, you're going to see here that we use sodium nitroprusside. We can use it for aortic dissection, right? So that's one use. In patient that has aortic dissection, you can use sodium nitroprusside. Remember, I told you I use IV esmolol, but you can use sodium nitroprusside, okay? All right. Here's another concept here. Let me find nitroprusside. Let's see, cardiology. Perfect. All right, here we go. Nitroprusside. All right, perfect. Here it is. So you see here, this is in our textbook here that we use here in Smash USMLE reviews, and you can see here sodium nitroprusside releases nitric oxide, increases cyclic GMP. It's an arterial vasodilator, decreases total peripheral resistance. Exactly what I just taught you. It's going to help you decrease your blood pressure, because the ultimate goal is to lower your blood pressure from 220 at least down to probably 160, right? Down diastolic, you want to keep it down below probably like 90, right? So because the patient doesn't have a massive stroke, they don't have an aortic dissection, they don't have, they can have all sorts of bad stuff going with hypertensive emergencies. Now, what do we use it for? Well, we use it for hypertensive emergencies. That's where the question came from, guys. And we can use it for angina and congestive heart failure. So those are the indication. But here's the side effects. Cyanide toxicity. But you need to understand that's because it's a really small amount of cyanide. That's why it's very important. And of course, if you lower somebody's blood pressure, so if you put somebody on a drip for too long, the blood pressure is going to drop, and then they're going to actually go into hypotension, right? So that's one of the biggest problems, right? When this happens to me all the time. Like if I start somebody on an IV drip in the emergency department, and over time, what happens is if you actually don't lower that blood pressure, if you lower the blood pressure too much, then the blood pressure is gonna drop. Okay, all right. I'm gonna drop the link for my students on Instagram also. Okay, cool. All right. So now, why am I showing you guys this, right? The reason I'm showing you guys this is because you guys can be able to use the book along with the Q bank, which allows you to study faster. Okay, allows you to study much faster. Now, to those of you that follow me on Instagram, I'm actually live on YouTube right now where I'm teaching. So if you want to see my screen, I'm actually gonna drop the link for you guys and pin the link for you guys who want to. If you want to follow me on YouTube, because I'm live on Instagram right now, so those people who are actually watching, so we're actually streaming live. Everybody who's joining live on Instagram, shout out to everybody right now. I'm teaching live pharmacology review on YouTube. So if you want to follow me on YouTube, you can go to my bio, click the link, and you can go straight. Or I'm actually gonna drop the link for those of you guys who want to let me just copy the link here and drop the link for you guys on IG, so you guys can have access to that. Okay, so you guys can be able to see what I'm talking about. Okay, so let me copy this. Shout out to everybody on IG. If you wanna watch me live of what I'm teaching pharmacology right now. All right, that's the link right there to my YouTube link. All right, and I'll put that link also in my bio for you guys, so you guys can be able to actually see this. Okay, sorry for the little mini interruption. Okay, but we're gonna continue our lecture. All right, so now the next thing we're gonna talk about. All right, I'm gonna pick another question here. Right, so we're doing USMLE review questions right now for those of you watching me live on Instagram. All right, and I'm trying to see how do you do this thing with the link on Instagram, which. Sorry about that. All right. So the next case is an 8-year-old boy who has a temperature of 38.8, right? But the first thing we're going to look at the options: acetaminophen, acetylsalicylic acid, ibuprofen, indomethacin, and naproxen. All right. And these are drugs that they're going to test you on the USMLE. So we have an 8-year-old boy who had a temperature, all right, of 38.8, all right, along with an upper respiratory infection over the past 2 days. His mother gave him his medication to bring down his fever. 2 days later, the boy becomes increasingly confused, lethargic, and starts vomiting heavily. Physical exam revealed a slightly enlarged or firm liver. His eyes are ecteric, which you can see right here. Okay, and which of the following medications is most likely responsible for this boy's condition? All right, so as you can see right here, we have an 8-year-old with a fever, upper respiratory infection over the last 2 days. Mother giving medication. 2 days later became confused, lethargic, and started vomiting heavily, right? Now your options are acetaminophen, acetylsalicylic acid, ibuprofen, indomethacin, and naproxen. Now, before you answer these USMLE questions, like I always teach you guys in my program, is that what do you think is the condition that's wrong with this kid? You guys understand what I'm saying? What condition is wrong with this child? All right. Let me see what's going on. We're having some issues with streaming. It's not enough streaming. Oh, okay. All right. I'm actually on YouTube right now. I'm trying to see what's going on. I need to check my settings. Okay. Give me 1 second, guys. Output. Let's do 2500 and ABR. Okay. All right, guys. I'm trying to fix my YouTube streaming because we're streaming live on YouTube right now. I'm teaching some USMLE reviews, so I think we were having some technology challenge. All right, just give me 1 second. Well, we'll fix some of these issues. Sorry, guys. Okay. All right. So for those of you guys watching me live on Instagram right now, I'm actually streaming live on YouTube. I'm teaching USMLE prep, and I just want to make sure that the stream is working perfectly because we were having some issues earlier. Give me just 1 second, guys. Sorry. Okay, give me 1 second, guys. Okay. Can everybody hear me very well? Okay, next. Okay. Here we go. All right, we're having some issues with YouTube streaming.